This talk is about the cognitive symptoms of depression and part of a series called Depression Deep Dive. Depression, as defined in the field of psychiatry, involves a characteristic syndrome of feelings, thoughts, and behaviors. In this talk, I'll review the cognitive symptoms, that is, the thoughts and thinking patterns that commonly arise in people with depression. To make this talk, I synthesized data from numerous sources, including various depression screening tools, the main diagnostic manuals used in psychiatry and psychodynamic therapy, and a few depression experts. The thoughts seen in depression fit into three major categories: thoughts of worthlessness, thoughts of hopelessness, and thoughts of lovelessness or unlovability. Together, these three kinds of thoughts make up the most common negative core beliefs in depression, as described by Beck. These three kinds of thoughts relate to the self, the future, and the world or other people. And this triad of negative thoughts about the self, the future, and the world make up the negative cognitive triad in depression, another theory described by Beck. Let's walk through each of these thought categories in more detail. Worthlessness involves thoughts of inferiority, like I'm no good or I can't do anything right, and thoughts of guilt, such as everything is my fault. Guilt is an example of personalization, which refers to attributing negative outcomes to your own actions, even without evidence that you are to blame. These thoughts show up in the DSM-5 and the PDM-2 as shown here. Hopelessness involves thoughts like things will only get worse or things will never get better, as well as thoughts of helplessness, such as it's no use or nothing I do matters. The concept of permanence applies here, which refers to believing that negative situations will never change, but will last forever. Again, we see these thoughts in the DSM-5 and in the PDM-2. Lovelessness involves thoughts of self-devaluation, such as I'm unlikable or I'm unlovable, and thoughts of persecution, such as the whole world is against me. These thoughts involve the concept of pervasiveness, which is the belief that negative events affect all parts of life, rather than only the specific context in which they occurred. Once again, here are examples of where these thoughts show up in the DSM-5 and PDM-2. So, this is the core triad of negative thoughts in depression. I want to point out that personalization, permanence, and pervasiveness form the three P's of pessimism, as outlined by Seligman and colleagues. In addition to these negative thoughts, thoughts of death or suicide may also arise. Commonly, this is a result of extreme hopelessness. Though there are many different risk factors for suicide, patterns of thinking that commonly lead to suicidal thoughts are hopelessness and permanence. For example, the belief that your suffering will never end, or that you are trapped in an unalterable situation. Thoughts of death show up in the DSM-5 as a symptom of major depressive disorder. Various other cognitive distortions may also arise. Cognitive distortions are inaccurate and unhelpful ways of thinking, and are sometimes colloquially known as thinking traps. Here are some of the most common cognitive distortions seen in depression, which can be remembered with the mnemonic MOPSAC. An in-depth discussion of cognitive distortions is beyond the scope of this talk, but here are brief summaries of these cognitive distortions if you are interested. Finally, the overall pattern of thinking that maintains a person in depressive thoughts is rumination. Rumination refers to cyclical, repetitive thinking that dwells on negative thoughts, feelings, and experiences and never makes progress. To make matters worse, rumination keeps depressed people focused on their depression symptoms, often amplifying these symptoms. So, in a way, it can be visualized as a whirlpool, sucking someone deeper into negative thoughts and cognitive distortions. That's the end of this talk. To summarize a few of the major points, the three major categories of negative thoughts in depression are worthlessness, hopelessness, and lovelessness. Worthlessness is related to negative thoughts about the self and the concept of personalization. Hopelessness is related to negative thoughts about the future and the concept of permanence. And lovelessness is related to negative thoughts about the world and the concept of pervasiveness. Thoughts of hopelessness are strongly linked to suicidality, and the process of rumination maintains depressive thoughts. I hope this is a useful overview of thoughts and depression, and I hope you'll join me for the next episode of Depression Deep Dive. Thank you.